Dr. Wanjiru, let's just understand infertility in men, because most of the time it's usually infertility in women that is, mostly highlighted. But in men, what does it look like?
Well, yeah, I'm happy to be on this show because I think it's a subject, as you said, that is really taboo. Nobody wants to speak about it, but it does need to be highlighted. People have always said that it's the woman's problem, but in effect, infertility is equal. If we look at the statistics, 30% of women will have a problem, 30% of men will have a problem, and 30% where both the male and the female couple will have a problem. And then in 10%, most of the time, we have no idea what's happening. That's the unexplained fertility. So male fertility is a contributing factor, probably 50 to 50%. What it looks like is really, most of the time, it's a semen analysis that will tell us that you have a male factor problem. So the couple usually come, they haven't conceived for a year or 2 years or 3 years. And we do a semen analysis, and it tells us everything that we really need to know.
And there's a term that you usually like to use, and that is sub-fertility. So every time I'm talking to you, I'm like, sub-fertility, remember. So there's sub-fertility and infertility. What exactly do you mean by sub-fertility?
So infertility, of course, is that there is no possible way of getting a child in terms of you have no gonads, so no sperm, and for the woman probably she has no ova or the very poor quality ova. So that's infertility, it will not happen. But when we say sub-fertility, it is that you have a possibility, you probably just need to do some forms of treatment or something else to help you get pregnant, but it's not an absolute.
And how then do you categorize an aspect of sub-fertility? Because I can understand, especially as a couple, you're married or not, still okay, right? Sometimes people are really either too quick to judge, hey, maybe I could have a problem or maybe not. So at what is the point of duration that you look at when it comes to sub-fertility?
So we feel that after 1 year of living together, because there are also couples who do not live together, but 1 year of consensual, of course, intercourse about 3 times a week, if that has been happening for 1 year and you are not getting pregnant, then we say you probably have an issue, a sub-fertility issue. You need to be seen. Of course, the tests then tell us whether it's really that you have infertility and will not be able, or if something can be done.
All right. And Dr. Bisango is with us finally. Hi.
Good morning.
Good morning. It's good to see you once again. Karibu sana.
Asante sana.
The question that we're asking the males today is how often do they go for fertility checks, right? So you are a urologist. Of course, you deal with men most of the time. The question on infertility in men, and of course we said this when we started the show, it's usually like hush-hush. We don't really want to talk about it. The men themselves would not want to talk about it because, again, a lot of stigma and all those things. So from your perspective, what does it look like when a man comes to you and says, hey, daktari, ni kama kuna shida?
Once more, good morning, viewers. Now, you've rightly put it. Infertility is a very tricky subject in men. Because from the way I put it, from time immemorial, men have been recognized as the people who are supposed to provide the seed for procreation. And if a man is not able to provide that seed for whatever reason, then he ends up feeling very inadequate. And he will go through a lot before he actually comes to seek help. Because society judges men very harshly for being unable to produce that seed. And so they will go around, they will beat around the bush, they will sometimes even ask people to help them before they come to a doctor. However, things are changing because I think in the current world that we're living in, men have realized that the more you talk about your problems, the easier it is to solve them. So it's not like the way it was maybe 10 years ago. And I think I can attribute that also to the fact that they are aware that solutions are present. And so more and more men are actually coming. And but it's still a very tricky subject for men. as opposed to women who are a bit more in touch with their emotions. Men regard this issue as judgment on their failure. Yes.
Okay. And I'm pretty sure you've had a lot of men say, "Ai, wanaume anashindwa aje." You know, like it's given that they have the seeds, but clearly there's a problem. But I'm happy that you're saying, you know what, we're seeing a lot of more men who are coming, you know, just to seek to understand what's going on. I'll come back to